Hi, my name is Dr. Staub, and this is Dr. Hudson. And today we're going to talk about cervical and lumbar decompression. This video is specifically going to be about cervical decompression, but we should have lumbar decompression on a separate video. So if you're low back, you'll reference that. Neck, this is your video. But this table is a decompression unit, and it fixes both scenarios, or at least attempts to. In most cases, I think it has at least an 80-some% success rate, and we did post the stats that you can reference on our website. But what we're treating is, in essence, this kind of thing: disc bulges that have been verified through MRI or CT. So if you just have neck pain or back pain and it's not verified through MRI or CT that you have disc issues, that's what we'd want to do first before we actually went into this treatment. If you don't have those, this wouldn't be your treatment. If you do, this is your baby. The purpose of this treatment protocol is to restore better disc height and suck in disc bulge without surgery. What it does is it lengthens the body out, and in doing so, by lengthening the body out, it sucks in the disc bulge. The analogy I like to use is with my shirt. On my shirt right here, if the middle of my shirt was your spine and these are your muscles alongside of your spine, when we have the effects of gravity, misalignment of vertebrae, and or trauma, it creates a shortening of our spine. And that shortening of our spine makes the disc material start to wrinkle or bulge out. So that vertical material height has to go somewhere, and unfortunately it starts putting pressure on nerve endings or spinal cords. So as we start to re-lengthen the spine, it sucks in those disc bulges just like the wrinkle in my shirt. It's called decompression, and that's exactly what it's doing. It's decompressing the spine. So it makes common sense, and it works even better, which is nice. What we're going to do is we're going to demonstrate with Dr. Hudson how the treatment protocol actually works. I've been told it's kind of like the rack meets a computer, and it's probably a pretty good analogy, but it works very effectively. So we're going to stretch Dr. Hudson out with the use of this computer over here. And if you can see closely here, the computer allows us to monitor a couple of different things. Number one, it allows us to monitor rest time, pull time, percentage of rest time, and force. And we're going to go over them this way. So we're actually going to pull on Dr. Hudson's neck with a 20-pound pull. We can vary that out by switching this force application to higher or lower. And as I said, with Dr. Hudson's treatment today, we're going to start with 20. Normally with patients, I would start with less, but today we're going to start with 20. We can vary out the time, and our treatment protocol is going to be initially 20 minutes, and they'll move up towards 30 minutes. We can also vary out the time percentage of rest, meaning if we're pulling at 20 pounds initially, when it goes into the rest mode, it'll pull at 10 pounds. It also allows us to vary out time or seconds of pull or seconds of rest. And we're just going to start out with a 15-second of pull and 15-second of rest. What that means, in essence, is that we're going to lengthen Dr. Hudson's neck at 20 pounds of pull for 15 seconds. And then after that, the table will shorten a couple of millimeters, and it'll drop that pull to 10 pounds of pull, and it'll hold that for 15 seconds. And then it'll go back into the pull cycle for 15 seconds, lengthening at 20 pounds, and then back into the rest at 10. And that variance of pull, relax, helps us to stretch out those paravertebral musculatures, thereby sucking in that disc bulge. So we're going to start out right now. If you notice, Dr. Hudson's holding something right now. We call it the pickle, and the pickle in essence has a button on it. If he depresses the button, go ahead, Doc. It will stop the computer right then and there and stop treatment. So if it at all gets uncomfortable, the patient can turn it off at their will, which is nice. So we're going to start out with the 20, as we said. Let's reset here to 20. And then when I start it, which I'm going to tell you in a couple seconds I'm going to start it, you're going to see the table actually run out and lengthen, which means it's decompressing his spine. Ready for us, Doc? Yep. Here we go. And as you can see, that table just ran out a couple inches there, which isn't astronomical, but it's enough that it actually starts lengthening his spine. The cradle holds the base of his head nicely, and it should be a gentle pull. As you can see, it just went into a relax mode, and it shortened up in that rest mode. At a 10-pound pull, it's going to do that for 15 seconds. We got 5, 4, 3, 2, 1. It's gone back into the pull, and as you can see, it's just a couple millimeters of pull to go into the 20 pounds of pull force again. How's that feeling, Doc?
Feels good.
All right. And that is cervical decompression. So that treatment would go on for about 20 minutes today, and as he got through care, subsequent visits, we would increase the length of time and or poundage depending on what we were treating. That's it. If you have any questions, feel free to give us a call. The number here is 480-990-BONE or 480-990-2663. My name is Dr. Staub, and I look forward to treating you.